Hi, Pat.
Hi, Shana. I'm glad we have the opportunity to get together today to provide information to this year's class that's going to be taking the ADEX patient dental hygiene exam. This is something, these webinars are things that we've been doing for a long time, and we love them.
Yes, we do love them, and we hope that you joining us today love them as well. These are really meant to be a tool, right, for you to help as you study, prepare, and get ready for the ADEX dental hygiene examination. We're going to start out really quickly on where you can find some resources about acceptance of the ADEX patient-based dental hygiene exam. In this slide, you are seeing where we are actually tracking this on our website. So while the patient-based exam acceptance is very nationwide, it is the map furthest away from us that's mostly purple. That purple map and the purple states indicate ADEX patient-based acceptance of the examination. So it is quite impressive of a map that the portability that you will receive in taking this patient-based exam almost takes you anywhere across the country. There is no other examination in dental hygiene that offers this much portability to you in taking a patient-based exam. Pat, I see you nodding your head. Any feedback? I mean, it's exciting to think about the portability alone in the opportunity of taking this patient-based exam.
Absolutely. For so many of us that had to take so many different exams to go to different states, this is just something that we've all in the profession been working on for a long, long time, and we're just about there.
Yeah, for sure. And I want to point out on that website, you can go to these maps. They are interactive. So you can choose to see different types of views of who's accepting what. You can scroll over the state to see how long these exams are going to be accepted. The good news is for you in taking this patient-based exam, again, that map is pretty standard. It is pretty steady. There aren't any changes coming to that, unlike the counterpart of our mannequin-based exam that's got a little more fluency in that simulated patient process. But for you preparing for the patient-based exam, this map up here that's predominantly purple is exactly the acceptance that you can expect with your ADEX dental hygiene examination.
Right.
The other thing I'm going to point out real quick that is also available on our website are the manuals. The 2022 manuals are ready and available to you. So you see you've got two different options between a patient treatment exam and our simulated patient, formerly referred to as mannequin treatment examination. So the patient-based exam is the exam you're going to be preparing for. The videos Pat and I make are useful tools for the complement of these manuals, but please use both as you prepare for the exam, because while Pat and I try to cover it all, it's just not quite possible to maybe cover all the small details that will help you really be prepared on exam day.
Yeah, I like to think we're giving the bigger highlights, but the small details are still contained within those manuals.
Yes, absolutely. We have and want to kind of cover what it is about ADEX that makes it unique. The ADEX exam is two components. You have a written OSCE, which is referred to throughout your manual as the CSCE OSCE. That is the exam you're taking at a prometric testing center. And in either format, patient or simulated patient, the OSCE is a requirement. As I just kind of alluded to, though, you do have a clinical choice, which is either the patient-based clinical exam or a mannequin-based clinical examination, also known as simulated patient. So these two processes are combined to equal the ADEX dental hygiene examination. By what you saw previously in the maps, there is some portability difference between the two, but ADEX itself is an OSCE and a clinical-based component. Pat, I know you're getting ready to, as I've defined the OSCE as an OSCE, the CSCE, I know you're going to cover that for us here in a little more detail to help prepare for what's coming in the OSCE as well.
Absolutely. Thanks, Shana. I do want to just take a minute when we talk about the OSCE, the CSCE, you may hear about it as the computer exam, as the written exam, as the CSCE, as the OSCE. Any of those, we're all talking about the same thing. It's this 100 item test that you go to a prometric center, you schedule yourself and you go to a prometric center to take. The content of the OSCE is based on an occupational analysis, and it is it tests skills, entry-level skills beyond the hand skills of calculus detection, calculus removal, and probing. It's very widespread. It's clinically based. You sign up for it when you're ready to sign up for it. Everybody can do it at their own pace and when they feel that they're ready to do it. Our questioning, it's not just a multiple choice test. There's some interesting formats called alternative tests. And there's, you can see, for example, we can test intraoral exam. There's different kinds of matching. It's different kinds of hotspots. It's really utilizing our great technology in the testing area and taking the exam. I'm not going to tell you it's fun to take it, but it is very interactive. And it's a great way of measuring a higher level learning. So the CSCE is something that we are really very proud of and is an integral part of the ADEX dental hygiene exam. And again, you sign up for it when you're ready on an individual basis. You will find out your score that day. Some people take it before they take the clinical exam. Some people take it after. It depends whenever you want to do it. It's not like preparing for national boards. It's very clinically based. It's entry level, and it's the things that you see and do every day in clinic. So that's the OSCE part of it. Let's just talk about the patient case examination, the patient treatment clinical examination. And let's just start with the basics, because it's always, everything is about the basics. What the examination is a case selection, and that case selection is a full primary quadrant that has at least 6 natural permanent teeth, and that quadrant must include at least 1 molar. You also, in a secondary quadrant, have 2 posterior teeth, and 1 must be a molar. So again, a case selection is 1 primary quadrant, and it's 2 teeth from a second quadrant. You may not go into a third quadrant. The teeth that you select in the second quadrant must be posterior, and 1 of those must be a molar also. So that is what, when we say case selection, that is what we are referring to. So that's what you're going to be treating, and you have to have 12 surfaces of qualifying calculus within that case selection. So there must be 12 surfaces. Of those 12 surfaces, 8 of the qualifying surfaces must be on posterior teeth, and of those 8, 5 of them must be on proximal surfaces. So 5 pieces of calculus, qualifying calculus, must be on the proximal surfaces of the posterior teeth, and 3 of those should be on molars. So this is the minimum requirement. My advice to you is to have more than 12 surfaces of calculus within your case selection, to have more than 8 on posterior, and to have more than 5 on the proximal surfaces, and especially have more than 3. This what we call calculus distribution of 853 is worth 5 points. If you have the minimum and you miss one, that an examiner does not verify one of your surfaces of calculus, that one error is going to cost you the 5 points for calculus distribution. So it would be smart to make sure that you have more than just the minimal distribution requirement of the 12,853. I mean, then that's an all or nothing. As I say, you make one error and you lose all the points. So the 12 surfaces of qualifying calculus can be on any tooth within that case selection. It can be on the 2 extra teeth in the other quadrant, or within the primary quadrant. There's no limit to the number of surfaces of those selected surfaces on any one tooth. So you can have 3 surfaces on one tooth, or you can have 1 surface. But remember, only 2 quadrants can be included in a case selection. There are certain teeth that you cannot include in your 12 qualifying surfaces. You may not use a tooth that has an implant. You may not have a partially erupted 3rd molar. You cannot have a qualifying surface on a primary tooth. And if these teeth are, if you do include, and say you have an implant or a primary tooth within the quadrant, you may not have a qualifying surface, one of your 12 surfaces on those teeth. They can be there, and the only requirement that they can fulfill is that they could be a contact, because you have to have a molar within a 1 millimeter contact, 2 millimeter contact. You may utilize one of these teeth, an implant or a primary for that, but you may not have one of your 12 selected surfaces on it. So those are the cannots. And then there's the ones that we strongly discourage. We strongly discourage you don't select a tooth that has not a primary tooth, but we don't want you to have anything with gross caries so that the tooth is going to collapse. A patient with advanced periodontal disease in 6 and 7 millimeter pockets, you are setting yourself up for huge risk. Extensive or full partial veneers, stay away from those. Stay away if you can from furcation or teeth with mobility. Any of these deep pockets, defective restorations, ortho brackets, we strongly discourage, because if you have them, you're going to increase your risk of having something go wrong. Hard to access the calculus. What if that tooth with gross caries collapses while you're trying to scale it? There's all kinds of areas, all kinds of reasons for not including them. But they can be if you have to, but we strongly suggest no. Radiographs are an eligibility requirement. You do have to have them. They are not used to verify the presence of calculus. You don't have to see calculus on them. We're not going to evaluate your technique. And actually, you don't even have to take them yourself. But they do have to be taken. The full mouth series has to be taken within the last 3 years, whether it be a pano, or whether it be a full mouth. What we are going to assess you on is your ability to look at it and to select images that are diagnostic. That's what we're looking for, not that you've taken them, or we're not looking for any specifics on it. And the radiographs that we're going to be looking at are those of the case selection, not the entire mouth, but just those images of teeth within the case selection. The full mouth series or your radiographs must be of diagnostic quality, and show the DEJ, the crestal bone, and the mesial and distal surfaces of all teeth. We also say that the apices of all fully erupted teeth must show up. You must be able to see them on at least one view in the radiographs. There is one exception that has been made in the recent past, and it is with a sigh of relief for many people that this exception is now made, but you do not have to, on your radiographs, the apices of the distal root of the third molar does not have to be visible. I don't know how many times people would take extra radiographs to try to get that view, and it was excessive radiation to the patient. So that is the only exception, but of being able to see the apices of all of the roots of all of the teeth, with that one exception. If a PA does not show the apex, but another PA does, or the PAN does, we're okay. So the radiographs must be evaluated for diagnostic quality. They must be within the case selection. We already said that. That is what we're looking for. They also must be.
Hey, Pat, can I ask you to clarify then? If the X-ray is outside of my case selection, so it's not in my primary quadrant or my secondary quadrant, those X-rays are not evaluated. Nope. As far as looking for apices concerns.
Right, we're not looking for apices. We're not looking to make sure that we can see the CEJs or any of those diagnostic qualities. We are just evaluating case selection. And those radiographs must depict the current condition of the patient's mouth. If they do not, if the patient has had treatment, extraction, or whatever, so that they are not an accurate depiction, on the front of your progress form, under the notes section, that's where you will describe the discrepancy. The patient had treatment and what it was, a restoration, an extraction, whatever. So that between your radiograph and those notes, there is a depiction of the current status of the patient's mouth. The radiographs must be mounted correctly. They have to have the patient's name. You don't want your name on it, but the patient's name should be there. Put the exposure date. They have to be marked left and right. If there's any school affiliation, that's a great place to put your ID label right over it so that nobody knows. And there is that anonymity from your school. And please print them on quality paper. We have to be able to read them. You have two choices. You have an option of a Panorex, if it's taken within 3 years, or you have the option of a full mouth series. You do not have to have that this full mouth series can include bite wings or not. You do not, bite wings are not a requirement of this examination.
So Pat, I'm going to ask one more question here. So my clinic, and I am playing the role of the candidate here. My clinic doesn't, we use monitors to project all of our images. Are we allowed to use those images on our computer systems? Can we pull them up for the examiners, or must they be printed?
You can pull them up, but we do have the requirement that they be printed.
Okay.
So that we do have them. Okay, so and the quality of paper be good. For third molars, any fully erupted third molar in the primary quadrant must be included in the case selection. The operative word here is fully erupted. If the third molar is not fully erupted, then it will not be, it's not a tooth that you should be treating. So it would not be part of your case selection. So even though it's in that quadrant, it is not going to be a tooth that you will treat. And what's considered not fully erupted, if there's any soft tissue covering any part of the occlusal surface, if the tissue is up on the distal, or if the tooth is not erupted to the occlusal plane. Those are examples. They're very clearly delineated in your manual. But if that is the case, when you meet with the DSM and you're asked the question, are you treating the third molar? This is when you would say no. The question is not there just for an optional, yeah, well, do you feel like treating the third molar? You know, some people say like, oh no, I don't think I will. No, I'm not. Well, why aren't you treating it? Oh, well, you have to have a reason. It has to be not erupted. If it is fully erupted, then yes, you must treat it. It is part of your case selection. If it is partially erupted or not erupted, it's not part of your case selection. So here are some of the forms that you're going to be using. These are all available online, and when you register, you're also going to get them in your packet. The dental hygiene case selection worksheet just states what it is that you're going to be doing. You list the 12 surfaces in ascending numerical order so we can keep it straight. You're circling what is your primary quadrant, and then telling us what are the 2 additional teeth that will make up your case selection. You're not there putting surfaces, you are putting teeth. So over to the left, you're putting 12 surfaces and then 2 teeth. You have the opportunity to enter your teeth selections from your worksheet onto your online profile. That is something that you can do, but you don't have to do. If you are going to do it, you go into the registration and it will walk you through in putting in your surfaces. If you go in and it doesn't accept your surfaces, it may very well be that you are you have gone beyond the deadline. It must be done within 48 hours before the examination begins. And if the examination begins on Friday and your exam is on Saturday, it's not 48 hours from your Saturday exam, but it's 48 hours from the beginning of the exam, which would be on Friday. So if you go to enter them and you're not allowed, it's okay. Just bring your case selection worksheet. When you meet with the DSM, we will do it on site. If you do submit them electronically, we're going to review them with you. The DSM is going to review them with you on site anyway. So it isn't a loss if you don't do it ahead of time.
Pat, I do want to ask you a question about this because this is one that comes up often. And this is a great example because it's on this form. We have the candidate has listed posterior teeth in the secondary quadrant as 12 and 14. We also have surfaces within the case selection on 12 and 14. They are allowed to use those 2 teeth and encouraged to use those 2 teeth as part of the case selection. It doesn't all have to come from the primary quadrant. We always have questions about where these 2 teeth come into play and how they can use them.
Yeah, really, I'm glad you brought that up because actually the reason that the case selection does have those 2 additional teeth is to give you additional opportunities, 8 additional surfaces to find those 12 surfaces of calculus. If you don't need them, you still have to put them down. You still have to treat them. You still have a case selection that is the quadrant and the 2 teeth. You can use them. You can use surfaces on those, or you don't have to, but it's giving you more opportunities of surfaces to find your 12 surfaces. So you are going to submit 12 surfaces of qualifying calculus. And the first examiner is also going to try to find 2 additional surfaces within your case selection that you have not selected that have qualifying calculus on them. And they're going to add those 2 to your 12. So basically what this is giving you is a little bonus. It's giving you 14 opportunities for the computer to select 12 surfaces of qualifying calculus. If you don't, and that's why I said before, don't just do the minimum, just don't find a patient if you can, and we know how difficult it is to find patients, but don't just find a patient that has those minimum 12 surfaces. Try to find a quadrant that has more surfaces in it so that that examiner has an opportunity to choose 2 more surfaces. As we said, it will be within the case selection. It gives you those 14 opportunities. The computer is going to be, all 3 examiners are going to evaluate those 14 surfaces and see if they validate. And the computer is the one who is actually going to be submitting, who is going to be selecting what your assignment is going to be. So you may select 12 surfaces of calculus and submit them, but those aren't necessarily the teeth that you're going to be graded on with your case selection, with your case selection qualifying calculus. On the back of your treatment select sheet, of your selection worksheet, get that out, wasn't easy, is your candidate findings. So when you do your calculus detection, you're going to write your findings right down here on the back of this sheet. Your assignment is going to be that you're going to be assigned 3 during pre-treatment evaluation. The examiners are going to assign you 3 teeth to do your calculus detection. It's going to be on in a quadrant that is outside of your case selection. You're going to record if there is qualifying calculus. Okay, so you're going to be doing all 4 surfaces, mesial, distal, facial, lingual, and what you're looking for is qualifying calculus. So in this example, on tooth number 18 that you've been assigned, the candidate has decided that there is qualifying calculus on 18 mesial and 18 distal, but there is not on the facial and on the lingual. So you are going to be doing this. You're going to be transferring transferring those numbers from your progress form onto this back candidate findings. And you're going to, this is your worksheet. It's not going to go into the evaluation area. You can cross out, you can erase, you can do whatever you want on this sheet. Just make sure you don't make a mess of it so that you can read it. You're going to be taking the information from this sheet and meeting with the DSM and entering it into the scoring system.
So Pat, can you give it, we focus a lot in this calculus detection on qualifying calculus. Can you just quickly give us a synopsis of what qualifying calculus is? Because if whoever may be listening to this has also been deciding between a mannequin-based exam, simulated patient versus patient-based, this is a varying decision between the 2. So in this exam, the question to the candidate, is there qualifying calculus? And the answer is yes or no. If so, can you just define what that qualifying calculus means?
Right. The qualifying calculus is the requirement for on your removal teeth and also for a yes on your calculus detection teeth. Qualifying calculus is calculus that is moderate to heavy. It is something that it's not just a click. It's something that you put the Explorer in, it digs in, it gets underneath, you feel a ledge. And it is probably not your typical recall patient that just has a very light and it go in and it just flicks right off. So think of it as moderate to heavy. And it has to be enough calculus for you to demonstrate your skills. And that's why we have that requirement. In the non-patient exam, the calculus is already on the teeth and it is all qualifying moderate to heavy calculus so that you as candidates can demonstrate your skills. Is that enough? Does that explain it to you?
Yeah, just in case they happen to be comparing exams, that is a difference between the 2 that is measurable between, I won't even mix these up, but qualifying calculus for the patient-based exam is the key words in that section.
That's right. Whenever you have to detect calculus in this exam, it's always what you're always looking for is qualifying calculus. Another component to this exam is a periodontal measurement exercise, and this is done after scaling. You're going to be assigned 2 teeth, again, at pre-treatment evaluation. Your patient's going to come back, and on your progress form are going to be 2 teeth, 1 anterior and 1 posterior. They're going to be assigned from within the case selection. These are teeth that you have scaled. You're going to scale them, and then you're going to be doing 3 lingual readings. So it's 2 teeth, an anterior and a posterior, but you're only doing 3 readings per tooth, and they are the lingual readings. You don't want to probe a tooth before you scale it. You want to remove the calculus because you'll have a change in pocket measurements, and examiners are going to be probing after treatment. So you want to probe after treatment too. This is the important sheet on the examination. This tells it all. It says what the content of the exam is, what the criteria is, and what the scoring is. It adds up to 100 points. We have already talked about what is the case selection. It has to be the 6 natural permanent teeth. It has to have the molars, have to be 2 natural permanent molars, 1 in each quadrant, 1 in your primary quadrant and 1 in that secondary quadrant. Your requirements are met, that distribution of 853 for your distribution of calculus. And we already, I think, spent some time on that. I think we're pretty clear. Your calculus detection is worth 12 points. It's 1 point per surface. So that's a total of 12. And as you look at all the numbers, this is the big one. 66 points goes towards calculus removal. And these 66 points all have to do with those 12 qualifying surfaces. They're each worth 5.5 points. So remember, you're submitting 12. The examiners are putting in 2 more, but the computer's making the final choice. You know the 12 that you submitted, but maybe only 10 of those are going to be chosen. Maybe 2 of the examiners' surfaces that they chose are going to be part of it. So my advice to you, and I think it's all of our advice to you, is there could be 2 mystery surfaces in there, each worth 5.5 points. Your assignment, don't look upon it as 12 surfaces. Your assignment is to scale, to treat, to debride an entire case selection, which is that primary quadrant and those 2 extra teeth. If you do that and you thoroughly remove all of the calculus and debride all those surfaces, then you're going to be okay. So then that's the 66 points for that. You're probing 6 measurements worth a point apiece. Tissue management, you are evaluated on tissue, and it's 1 point deducted for each site of minor tissue. And I will say minor tissue damage is something that's going to heal on its own. If it's damage that is going to need an intervention by a specialist, it's going to need stitches, it's going to need a perio pack, something like that. For soft tissue, then that's considered to be a major tissue trauma, and that's a 100-point penalty immediately. Hopping down to final case presentation, that's worth 5 points, but you'll look at 4 of those are still calculus related. So really in this examination, 70 points are going towards calculus removal. 66 of them come from your 12 selected surfaces, and 4 additional from all of the other surfaces within your case selection that have not been assigned. So you treat every surface of every tooth within your case selection. At the end of pre-treatment, and this is something I don't even like to talk about, and I hope it's something that you don't even need to know about, but let's put it out there so that you do. If after pre-treatment evaluation, when the evaluators are going in and they are validating whether your 12 surfaces of calculus are present or not, if it's determined that you have not accrued enough points, you do not have enough surfaces of qualifying calculus to possibly pass this exam with a score of 75 or better, that's the passing score, the examination is going to be stopped and the candidate and the patient are going to be dismissed. You have to have enough calculus to be able to demonstrate your skills, and your calculus has to be of the quality that you can demonstrate that you know how to remove it. So let's hope that's something that we don't need to utilize, but I just wanted to know that it's there.
And Pat, to that point though, is, patient selection is key in this exam. choosing a patient, not trying to bring one that doesn't have enough and keep your fingers crossed, but to bring a quality patient that will meet the requirements, but also isn't too difficult to treat during an examination setting.
Right. So is it a patient that you want to have treated before? I caution you of treating anything within the case selection. Again, we want to make sure that the first examiner has access to teeth with, additional teeth with or surfaces with calculus. You also want to make sure that you're not just doing the bare minimum of the distribution. Is it nice to know if that calculus is going to come off, maybe on a tooth or two or a surface or two, but to treat the patient, to bride the patient ahead of time might not be in your best interest. So don't look for the easy patient, look for the patient that you know is going to qualify and you have the skills to remove it. You don't want to go in there nervous if your case selection is going to be accepted. Go in confident of that and confident that you're going to be able to remove it.
Yeah, great advice, Pat. Well, we'll finish this up with just kind of a few how to reach us after this webinar. You can come back and hit play on this as much as you want. Spend as much time with Pat and I as you can possibly stand before you get to your exam. But if you've got some questions that haven't been answered in this webinar, you can go to our website, click on Contact Us. We have a licensure candidate specific team ready to help. It's our candidate services team. So you can ask any questions there and the team will be happy to get back to you with those responses and help you get through your questions. Pat and I thank you very much. You can, again, go to our website to reach our team. If you're an educator and you're watching this and you have some additional questions, you can reach out to me directly. So happy to be a part of this. Pat, thank you so much for the wonderful information. And again, I hope those out there watching this enjoy it as much as we do in sitting here making them.
I certainly hope so too. And in addition to the in-office team and staff that are available, I want to encourage everybody to please participate in the, it's probably going to be a Zoom Q&A, question and answer period that's going to be held by your exam team. And the school, co-hosting the school and the exam team. It'll be held the week of your exam, and it's going to go over all the site-specific information, and it's really very, very helpful information. So I do encourage you to please, when you get the email, put that on your calendar and do attend. And do remember that there are 5 people at this exam that are assigned to help you get through the process. We can't scale for you, we can't probe for you, we can't do your calculus detection, but we know the paperwork, we know the forms, we know the process, and that's what we're there to help you with. So please don't arrive nervous about the paperwork, because we're going to help you with all of that paperwork. You can find other things if you want to be. We're hoping that these videos are going to help alleviate your fears, but don't come afraid of the paperwork, because there's lots of us there that are going to help you. And thanks for tuning in.
Yeah, thank you guys so much. Till next time.
Okay.
Bye.
Bye, Shayna. Thank you.